Keep coming.
Good afternoon, everyone, and welcome to the City of Alameda Mayor's COVID-19 Town Hall. I'm Sarah Henry, the city's Public Information Officer. Mayor Ashcraft invited special guest Dr. Erica Pon, the Alameda County Health Officer, to join her today. Please note, all participants have been muted. In order to submit a question, we'd like you to use the chat feature. And then following their opening remarks, the Mayor and Dr. Pon will be available to answer your questions. I'd now like to turn today's Town Hall over to Alameda Mayor Marilyn Ezzy Ashcraft.
Thank you so much, Sarah, and welcome everyone. Thank you for joining us. I am thrilled and we are honored to have a very special guest. This woman has been working pretty much 24/7 for months now to keep our communities in Alameda County safe and healthy during this public health crisis. So our guest today is Dr. Erica Pon, the interim public health officer for Alameda County. And Dr. Pon is, she may have some local roots because she did her undergraduate work at Stanford, where she majored in human biology before going on to Tufts University, where she earned both her MD and her MPH, so her medical and public health medicine, public health degrees. And she is a pediatric infectious disease specialist who is an attending physician at Children's Hospital and Research Center in Oakland, as well as a clinical professor of infectious disease, pediatric infectious diseases at UCSF. And she has worked in the San Francisco Department of Public Health, including as the director of their Bioterrorism and Infectious Disease Emergencies Unit. And Dr. Pon will tell you a little bit about this remarkable collaboration among the Bay Area's county and one city public health officer that has served us well throughout this public health crisis, and was also the first in the nation to follow this model, or to actually, I think, invent this model. So with that, I want to introduce Dr. Erica Pon, and thank you so much for taking time out of your very busy schedule to join our community today. Welcome, Dr. Pon.
Great, thank you very much, Mayor Ashcraft. It's an honor and pleasure to be here. And I'd like to start by just thanking all of you and thanking the community for, for trusting in us as your public health officials and really, truly sheltering in place and complying with physical distancing. And we know it's hard to not be socially together, but we're trying to really emphasize social connection. So it's great to have these kinds of forums too, while physically distancing. And maybe to sort of wrap in some of the history that you just heard from my bio and thinking about the Bay Area, when I was in San Francisco, I was really focused on actually, again, infectious disease emergency planning and pandemic flu planning. And we had a subcommittee at the time that I co-chaired. We were actually worried in 2005 about the avian flu. Some of you may remember that. We did a lot of pandemic planning around that time because we were worried that was going to be our next pandemic. And over the course of a few years, actually, the Bay Area health officers, and at the time I was sort of not a health officer, but at a level where I was really focused on that planning, we had a subcommittee really working on these issues as a region to think about what would we do when we had our pandemic. And then we had the opportunity in 2009, I was actually still in San Francisco then, but to experience a pandemic, which thankfully that one was much milder. That one actually started in California, so we didn't have as much lead time. But we did have that experience that many of us who are still here in the Bay Area worked through together. So we have a really strong connection and network, which is really nice. The health officers actually in the Bay Area meet every other month for an evening meeting. We also have a statewide health officers group that is more formal and an advisory to the state health department. So we have a lot of networking that happens anyway, but certainly a strong connection here in the Bay Area and a lot of history of planning about what we would need to do if we had our first pandemic. So all that being said, this has, of course, been a really, as Mayor Ashcraft mentioned, we have been, I believe we just determined this is our 17th week of activation. We've been really busy since mid-January once we first learned about, coronavirus in China and starting to monitor incoming travelers. And so we actually started having phone calls twice a week with this regional health officer group in February, probably, if not sooner. And I've been talking and thinking about this. And then I'd say, as far as the shelter in place, again, we knew that that was one of our extreme, what we call mitigation techniques that we need to do if things are getting escalating out of our control. We tried first to do what we call containment, which is really doing that active case finding and testing, but as you all know, testing was a challenge and still is a challenge, but we're really improving on. So there was a weekend when, Santa Clara, of course, is the biggest Bay Area county and also had the first case in the Bay Area and one of the first in the nation. Had also had SARS cases in 2003, actually, as another just experience in the Bay Area. So we have a lot of great smart minds, and we were, over the weekend, there was some discussion about really the rapid escalation, exponential increase in rise of cases that was very concerning. We're also, of course, seeing what was happening in Italy and super concerned about how devastating, the pandemic was in Italy, what was happening to their healthcare system, the really difficult decisions they were making to try to care for people, and how many healthcare workers were in harm's way. So we had a very sort of rapid, quick discussion over the weekend. I remember it very well. I will always, I'm sure, but I guess that was March 15th. It was a Sunday. And we kind of discussed and realized we needed to act and that every day made a difference. So we, amongst the 7 of us in the core Bay Area, made the decision quickly. Then we got our county councils and city attorneys on the call and worked for really over 24 hours to not only align on a decision, but on the very legalities of the order that we issued together about sheltering at home. So I am really proud of us, actually. I think it's a great network, a lot of great complementary sort of health official minds and colleagues that knew we needed to do the right thing, and we knew it was much better and more effective to do it together, not only because we are a region and, of course, diseases don't have jurisdictional boundaries, but we also knew this was such a dramatic intervention that in order to get sort of community support, which again we really are grateful for, it was really helpful to do it together. So that's just a brief background on that. And we continue to really try to work closely together. As you can imagine, just with any group, we have a spectrum of opinions and perspectives, though, which I think is good, but makes it hard sometimes to have full agreement. So that's why you've seen a lot of, overall alignment, but definitely some distinctions as well. So we're trying our best to stay aligned because we know it does confuse people or impact people differently if many of us live in one jurisdiction or work in another, or your kids might be in a different jurisdiction, especially here in Alameda County where Berkeley has its own health jurisdiction and own health officer. So, and specifically on that, I think the Berkeley health officer and I have a very close relationship, and really, I feel like we've always aligned just to make sure we know it's hard for the community to see if we're not. The other thing I'll just touch on along those lines, so as you know, we issued that first order mid-March, and then we extended it at the end of May, and then the end of March, and then we had just made a new order effective Monday, May 4th, sort of extending but also loosening up some things. So as you all know, we loosened up construction activities, some outdoor businesses and outdoor activities. We also explicitly said that childcare really also included sort of educational and programmatic activities, so not just preschool age, but trying to now come up with some parameters around education. We, of course, know, and I as a parent know, and as a pediatrician, that this is a really hard time for families and kids to be cooped up and not having structure, especially in our most underserved communities. So those were things we already loosened, and they just became effective on May 4th. And we did learn a few days into that the state was about to also come up with some different guidance. And as you can imagine, and as you've seen probably in the media, we have a very diverse state, and there are some jurisdictions, especially in the very rural areas, that have no cases or maybe 1 or 2 cases, and they're really anxious to get, back and moving. So I think the state, understandably, has the tough job of trying to address our very, diverse spread of disease and communities. So the state, as you heard yesterday, did come up with a new issuance that an early phase 2, and we were calling our phase sort of 1.5, so it's all sort of related, but the state issued a guidance that retail curbside could start today, actually, and some other manufacturing and warehouses to support that. But here's how this works. So legislatively and legally, if there are state health officer orders and local health officer orders, whichever is stricter prevails. So right now, we're still a little bit stricter in the Bay Area and here in Alameda County. So we are not yet allowing that retail curbside, and I know that's, again, confusing, but here's our rationale. So Monday, we just loosened some things. The way this disease works, we need a week or 2 to really see the impact of that, and we really want to do this safely and carefully. We don't want to backpedal on the hard-earned success we've had and really saving lives. And we've estimated that the number of deaths in the Bay Area is under 400, and the estimates early on and projections were that we would have 20 to 30,000 deaths in the Bay Area. So we really exponentially, we have collectively, again with your support, saved lives, and we don't want to, this disease can really escalate so quickly, so we want to be as careful as possible, also recognizing that, the socioeconomic harms and the other health harms of this intervention are difficult. So we're trying to navigate this together with modeling, but granted, we're learning more every day about this disease and trying to make good decisions together, which is also why it's really powerful to do it as a region. And then the last thing I'll say before I take questions is that when we released our most recent order effective Monday, we also wanted to share with all of you what are kind of the indicators or things we're looking at as we try to decide what direction we can go, if we can loosen more, or if we need to hold our pattern, or in trying to, again, sort of suppress this pandemic and try to minimize the spread and protect our most vulnerable. So there's about 5 key areas. One is just the basics around, how many new case counts per day are we seeing? What's the trend on that? And related to that, what is the sort of status of hospitalizations of people with COVID-19 in our county? So the case rates actually do seem to be, even with more testing, and it's helpful, but we also know there's more testing, which is good. We're finding more cases and then making sure they're isolated. But we knew that we want that overall trend to improve, but we also want to find more cases. So we knew that might bounce around, but hospitalizations are a little bit more stable because the testing in that setting has been, there's been the most access there and the most priority there. But it's also a lagging indicator of the disease circulating in the community. So we wanted to look at both of those, and those currently are, again, I'd say the new cases per day overall over the last couple of weeks has trended downward, but there's bumps and spikes. And then hospitalizations have remained pretty flat. I'd say our peak of people being hospitalized was in mid-April, and it's decreased a little bit, but it's not just falling down. It's kind of flat, so which is okay. Again, we are not, the other important indicator is around hospital capacity, and we're certainly, with all the downscaling that healthcare operations did to, initially, stopping all those elective procedures and everything, we have a lot of hospital capacity right now in Alameda County. I'd say I think we're literally, the COVID patients are only taking up, I think less than 5 or 10% of the beds. So as you also know, healthcare operations are starting to slowly and carefully and safely, scale back up to now have those procedures that people have been waiting a long time to have, and they're also trying to make decisions about resuming healthcare operations. But with that, we're monitoring how many of our beds and ICUs are occupied by COVID patients to make sure that seems like it's not getting out of hand. And then related to that, also we want to make sure we have enough personal protective equipment, which there's been a shortage of, as you all know, and making sure we have enough in our hospitals, and then also our other partners in the SNFs, the skilled nursing facilities, nursing homes, and clinics are not, having a hard time getting personal protective equipment as well, so that we can, again, protect our healthcare workers. So that's one of the indicators. Then we're looking at testing capacity. So we have been, gradually ramping up in multiple different settings within the healthcare setting, but also all the community testing sites. We're working, we know that Alameda is very interested in testing sites. I know we're working actively and trying to get that going. So we're probably about a quarter of the way to our ultimate goals. We're following some regional and state guidelines. Again, they're sort of guesses, but we want to make sure that everybody who has symptoms can get tested, and that we can test in our outbreak settings, and that people who are, symptomatic, who are already out in the community working, that need to be working, are able to be tested. So right now we have definitely had increases every week in how many people are being tested, and I'd say we're about a quarter of the way there, but rapid escalation of that. And then the other indicator, just making sure I capture them all. So then our public health infrastructure. So I will say I take every opportunity to advocate for public health. We are kind of, we are people that when we're doing our job well, nobody knows what we're doing. We're like the silent success, right? And even now, I think some people are like, well, what was the big deal? Why did you have to do all this? There's no surge. And that's because we did our job well. But so we have not been resourced well either over the years. I think the last time there was a recession, and of course we're devastated as well that this pandemic is leading us into the economic situation we're in, but during the last recession in 2008, public health departments were really decimated. Our workforce and our staff were cut dramatically, and they were never really replaced. So in our jurisdiction of Alameda County, we have probably about 1.7 million people. We only, and there's over 80 reportable diseases before COVID, we only have 6 or 7 nurses or staff working on that. all the time. So right now we've scaled up to, there's over 60 people dealing with all the cases and contacts we're receiving, and you've heard, I'm sure, a lot in the media as well about needing to scale that up even further if we're going to have more cases as we loosen up. So our goals around that, this is regional as well, is that we can reach at least 90% of our cases and make sure they're safely isolated, and that of those cases, we can reach at least 90% of their contacts and make sure those people are safely quarantined. So it's both building up our infrastructure, like the testing, so we can identify the cases and then interview them, find their contacts, and make sure they're all safely isolated or quarantined, which again, as you all know, is not always easy in crowded households and things like that. So we're working at the county level to make sure that we have, places to safely isolate and quarantine people who can't do that in their usual homes. And then we've also been working very actively in the homeless community and trying to bring people into hotels or places, especially those who are most vulnerable, and starting to do a lot more outreach in those settings as well. So that's a lot. I think one other quick thing I'll just highlight is, again, thank you all for what you're doing. And I think the other thing to help if we can get your help to help amplify the message, I think I do see variability in the universal face covering, and I think that is going to be our new normal for a very, very long time. So as we slowly, can move out of this shelter at home situation, we're still going to be needing to wear masks. And the whole idea is that it is a public health thing, and that your mask protects me and my mask protects you. There's a little bit of the opposite of that, but really it's that we all need to do source control. So as much as you can help socialize that, if you, in a friendly way to others, but if you're seeing people not wearing them, it really is important for everyone to be wearing masks if they're going to be around other people. So that's something I feel like we have a little bit more work to do, and just with social distancing or physical distancing as well. So yeah, with that, maybe I'll stop and see. I'm sure there's a lot of questions.
Thank you. Yeah, and I'll let you know, Dr. Pond, just on this Zoom call, we're already up to 76 people watching, and then we're also streaming on Facebook Live. So you have a following. And I know, so this is the first time that I have actually met Dr. Pond face to face, although we spend an hour together every Wednesday because there's a very informative conference call for elected officials in Alameda County with officials from public health, from the sheriff's department. And, I've listened. And so I know a little bit. I know you are a mom, as you mentioned, of an 11-year-old. And even though the face covering requirement kicks in with 12-year-olds, you mentioned in one of the calls, Dr. Pond, that your 11-year-old wears a mask and doesn't complain. So I guess it helps to have a mom who's a pediatric infectious disease specialist. And I know you also mentioned one time that you're an avid swimmer and you will look forward to when the pools can reopen again, but it hasn't happened yet. Well, with that, we're almost to 80 people, and Sarah's told me that we have a lot of questions. So I'm going to, and I know Sarah kind of batches categories. So why don't we get started with the first question? Thank you so much for all the information you just shared with us.
Sure.
Ready when you are, Sarah.
Absolutely. So this question, the first question is about testing, which I know you just talked about, but folks are asking when testing in the city of Alameda will be available for anybody who wants to get tested regardless of the symptoms.
Well, two-part question maybe. I know I can tell you that we're working with County Public Health as we speak, getting a testing facility up and running in the city of Alameda sometime this month, before the end of the month, or if not early June, but very soon. But right now, and I'm going to turn over to Dr. Pond for the criteria of who is being tested now.
Sure. And I realize I was just talking to another county colleague in Contra Costa, and as we increase the capacity and availability, we will continue to expand, but we really want to prioritize the testing resources to where it can have the most impact. And so we have been trying to recommend at least that testing really happen for those who have symptoms, those who are in the high-risk occupations or settings. And then, of course, from the public health side, we're also doing testing when we're investigating situations, whether it's an outbreak or individual cases and contacts. So that is sort of where we're trying to prioritize those resources. But again, as we get more and more testing sites, we can certainly, I think admittedly, some of the community testing sites aren't being utilized enough, but I think our interest has been also making sure that when someone's sick and they're going to their clinic, they can get the testing, and trying to make sure those resources are in that place as well. Because the other nice thing that happens in the healthcare setting is, then the clinician can really follow up and make sure that, they're following that person clinically who is testing positive, they're getting the correct information and instructions about being isolated. So that being said, I think, we will be, as a community, gradually testing more and more people. I think the other caveat to testing without symptoms is, there can be more false positive or negative if someone doesn't have symptoms. And also, again, it's just one point in time. So it's certainly helpful if it's positive. If it's negative, it's just that point in time. And then as you're starting to see in other recommendations too, in certain settings, we might say, okay, well, if you're negative in, for example, a staff person in a nursing home, we probably need to test you every month just to make sure, like, because you're in that high risk setting. So, and with that in mind, trying to, again, as much as possible, put the resources where there's the highest risk.
Thanks.
Here's a question from we have a few reporters that are on the line as well, and here's a question from a reporter at Reuters. They're saying Governor Newsom yesterday allowed certain businesses, including manufacturing, to reopen as long as they follow some guidelines. Alameda County appears to stick to its May 31 lockdown order. However, what does that mean for local manufacturers, in particular Tesla, who are now reopening based on Newsom's announcement?
We recognize this is a very hot topic right now. We have had a lot of discussions with Tesla, and we've actually also recommended that, along with the other things that we want to wait on, that we have loosened certain restrictions on May 4th, and we wanted to see at least a couple weeks under our belt to make sure we weren't seeing an impact on our indicators from that loosening, or not a significant one that was concerning before we then loosen that next layer. So, and we also want to make sure that everyone has time to plan. So the three sort of related areas that the governor opened up would be the retail curbside and then the manufacturing and warehouses to support that. So there was some great guidance, but it was just issued yesterday. And so we are really asking our facilities within the county to that our local health order still prevails, and to wait until we have another week or so under our belt to see what has happened after we did that first round of loosening restrictions.
Here's somebody with a question on the dashboard that the county has with regards to all of the COVID data, and they're asking if we can have the information on the deaths in the city of Alameda, and also demographic information, age, sex, health conditions, ethnicity in the city of Alameda.
I think, because we have, 14 cities, it will be difficult to do it on the dashboard itself. If people want to request data, we can respond to, data requests. And then I think the other caveat is, I absolutely understand the interest in each of these, but because, again, testing has not been systematic or widely available, interpreting the numbers when they're small is from an epidemiologic perspective, it's harder to make generalizations if it's not systematically done and if it's small numbers. So that's sort of the other rationale for trying to just show the big picture of what's happening in our county.
There are a bunch of questions regarding Tesla specifically, and their plans to reopen today. Is the county giving them a green light? And where are the clusters in Alameda County aside from the nursing homes? That's two totally different questions from one person.
And I'll just interject. I haven't followed the Tesla story today. I take it that Elon is doing something more than manufacturing ventilators for the public health effort. He's
correct, and so we have not given the green light. We have asked, and again, we have been working with them, looking at some of their safety plans, and have had some recommendations. But no, we have not said that we think that it is appropriate to move forward. And then the other question was about, what's the second question?
Where are the clusters in Alameda County aside from nursing homes?
Oh, sure. So essentially, nursing homes are the big focus. We did have a recent cluster amongst one of our homeless encampments. And then we do have cases in the Santa Rita jail, and that has been public information as well. So we've been working really closely with those high-risk settings. So those are the main areas where we've had clusters in sort of the anticipated settings that it's very difficult to control the spread.
Here's a question saying just how Alameda County is working with all of these other counties, but what is Alameda County doing differently to target our own needs for our specific county?
So again, we are, continuously looking at the cases and the data that we're seeing and directing our resources appropriately to where we're seeing as the highest risk settings, the highest risk situations, and continuing to escalate and sort of the staffing needed to continue to respond to all of these cases and contacts.
With regards to automotive manufacturing plants, just in terms of when they would be allowed to reopen.
So again, we loosened some restrictions on May 4th. With this disease, the potential incubation period is up to 2 weeks, but it's mostly within 4 to 6 days, depending what studies you look at. So I think collectively in the region, we have said we want to look at least a couple weeks of data. We can certainly start and allow people some time to plan. So we anticipate over the next week that people can really be planning and thinking about that next step. And again, there's a lot of great resources the state just issued yesterday, and we, think that's great. Want people to look to those. We are going to be working, with our Board of Supervisors and others to help make sure that sectors can come together and share their best thoughts and, shared kind of templates for safety plans for reopening. So that's another area that we're working on, again, with our Board of Supervisors to come out with what our infrastructure will be locally. And if everything is looking stable after that couple weeks, then there's definitely a potential for that next layer of things to be loosened mid-May.
Here's a question. They don't say what specific sector they're in, but they're asking if there will be guidelines for how many people per square feet will be in businesses.
I think it's more the opposite, which we have continued to say as far as the principle is really trying to make sure people are about 6 feet apart is kind of the general guideline. So every business is going to be different, or someone could, I guess, reverse the math on that. But, but each space, it might be different to, if you have a linear space square footage versus a square, that might, you may be able to accommodate people differently. So it's more about trying to maintain that physical distance as best you can. And again, to have everyone universal face coverings, especially if there's any possibility of encroaching on that 6 feet distance.
And here's another question. Do you think it's possible for coronavirus to have been here since last November?
Well, I think the underlying question that is, when did it first start circulating in China? And I certainly think whenever it first started circulating in Wuhan specifically, it could have been very quickly circulating here. We know, based on that early monitoring of travelers coming back from Wuhan and flights from Wuhan, we have thousands of people that come back and forth from China to here. So certainly in the Bay Area, we have a lot of industry. I think whenever it was circulating in China, it was very likely to have circulated here. So we know at least January at the latest, but certainly it could have been December. And then if there was virus circulating in Wuhan in November, it's a strong possibility it could have gotten here that early too. On the flip side of that, we know that there was some virus circulating in early January, and we know that first death in Santa Clara happened in February. But we didn't see a healthcare surge, right, as we have seen in other parts of the world or country once the virus was really, really circulating widely. So I think that speaks to if there was some here that early, it was very low levels. And I'll also just say that I think based on a study that was done at Stanford, my alma mater, and in Santa Clara County, and then we're participating in a larger study that's going to follow up on that to look at sort of overall community prevalence. Right. But we think that probably the number of people exposed is much less than, it's probably in the 2 to 4% of the population range, based on that study. And then of the tests we are seeing coming back, the last couple of weeks, it's only been about 4 to 5% of the tests are coming back positive. And of course, people who are being tested, since they are primarily people with symptoms, have a higher, what we call pre-test probability. So we do think the amount of people who've been exposed so far is really low.
Is social distancing still required if both people are wearing masks?
That's a great question. I'm glad someone asked it, so thank you for asking. Masking is not a substitute for the physical distancing, but just knowing again that there are certain situations as we try to kind of resume our economy and our lives that are being within 6 feet is sometimes unavoidable. But So it's not a substitute, and all of this is the way the way I think about it, and the way I'd love for the public to start to think about this too, is we do come up with policies to try to have some clear policies and clear our lines in the sand, but it's all a spectrum, right? So the further away you are, the safer, and the closer you are, especially if there's no sort of source control or protection, then there's a possibility of someone coughing, or even, some of you have probably heard about the outbreak in a choir because people were singing and really expelling their droplets. So it's all about trying to minimize or reduce potential exposure.
This question is, in Europe, Italy followed a different path than Sweden, and in the United States, New York followed Italy's path and Florida followed Sweden's. What do you think is the best way to reach herd immunity?
To reach herd immunity.
Well, I
So
think there might be an underlying basic question of what do you think about herd immunity and its effectiveness or downside risks?
yeah,
But yeah.
yeah. I mean, it's definitely an issue of ongoing discussion and debate, which is, I'm sure, why you're all asking. I think that it is true that at some point, to get into to get to back to like where we were pre-COVID, we need to either have herd immunity that based on either vaccination, or it will have slowly moved through a higher majority of our population. And as I just said, we think it's less than 5% now. We think based on other diseases, you probably need at least 70 or 80%, if not more, who have been exposed and immune. We also don't know yet with this virus. We hope and think, based on most other viruses, including other coronaviruses, that once you're exposed, that you do have longer-term immunity. But even that, we don't know if it's like seasonal, just immunity for a year versus lifelong immunity. So that's all things we don't know yet either. And so some of the discussions also around, do you slowly open up so that you can get some herd immunity and try to especially allow the healthiest people, to get exposed so you can build up to that herd immunity. And I think, there's different modeling around all that as well. And regardless, I think we will be saying that the elderly and those with chronic medical conditions are the ones we want to sort of try to protect for as long as possible, while we're slowly letting other parts of our community, be sort of in contact with others. So it's a very tough and interesting question. And with this disease and the way sort of its severity and how infectious it is, can we slowly do that and yet not put our overall health system at harm and our overall community at harm of, exponentially increased deaths again versus, how do we titrate that? And that's our challenge that we're faced with right now. We want to titrate minimizing the spread, slowly allowing, our economy and our communities to resume, but not overwhelmed to the point where we're making really difficult decisions about ventilators for 2 people, or having to withdraw care because we just don't have the capacity, or as the tragic news we're seeing in New York about they don't even have enough refrigerator trucks for the amount of deaths that they have, and we really obviously want to avoid that. And we're trying to find that sweet spot, and we don't, again, the models are really a wide spectrum of how we get there, and so we're trying to do it carefully and thoughtfully.
This question is, do you have any antibody result-based analysis of what the actual, what the mortality rate has been in Alameda County?
So antibody testing is just starting, and I will just say also, because people are hearing about anything you see that's kind of immediate antibody response is not reliable, per everything I've seen from the state and other authorities. I think the good and bad thing right now with what's happening with the FDA is that they are approving all kinds of things with very little validity results and external validation. So I think we're trying to really, in the healthcare and public health community, really trying to have some other way to validate outside of the FDA saying that you can go start testing people. And even with antibody testing, even the reliable ones, so there's about 8 that have been, I think, actually I can't remember now anymore, it keeps changing. But anyway, there's a small number of labs that have been validated for antibody. But again, the problem with screening or doing any test when you have a low prevalence, so again, I said it's probably less than 3 to 5%. When you have a low prevalence, whenever you try to do a test like that, the data we're seeing, even with a really good test, your false positives are 50 to 60%. So it's really not data yet that we can look at for individual management. I think, again, we're participating in a great study that's happening in the region, but it's going to take 9 months, and it's going to be serial testing of people for the disease itself, the PCR and the antibody, to check how that looks over time, and there's a subset of healthcare workers. So that data will be really useful. I think early antibody testing now is, I think when it's done in a study situation and systematic, so we can look at the results and it will contribute to our overall understanding of the disease, that's really helpful. But the testing is not in a place now where I think it's really helpful for an individual or even for our public health response right now, is the way the testing works and the high rate of false positives that you can see.
Here's 3 questions from the same person related. First, they're asking about the pandemic response protocols and responses that you established that the mayor was referring to. And then they ask, what is unique and uniquely effective with the public health department's pandemic response activities? And then the third question is, why isn't our C-19, our COVID rate, flattened?
So they're asking about our pandemic response activities, sound like, and then
And then just how the Alameda County Public Health Department pandemic response activities are uniquely effective, different from other Bay Area counties, I suppose. And then the last question is about the rate and why we haven't yet flattened that rate.
Okay, so I have to say I don't know that we're unique, but I'm very proud of the response we have. Again, continue to amplify and escalate. So, we have an entire department operations center, an emergency operations center, and the key elements of any infectious disease emergency response are the things we're doing, which is epidemiology and surveillance, and that's case and contact investigation. And then we have a disease containment branch that's really looking at all those contacts, making sure they're isolated, or the cases are isolated and the contacts are quarantined. We're trying to work with our emergency operations center again to start to really improve the wraparound services to make sure those people can be safely isolated and quarantined. And then really ramping up testing, as we're hearing about. We're really trying to escalate that and work with the city and community partners, and we're getting some resources from the state to do that, and our healthcare partners, which are really rapidly expanding as well. We are working closely, speaking of that, with our healthcare partners. We've been doing a lot of surge planning because, again, early on, we thought we were going to really have an overwhelming we thought we would overwhelm our healthcare system. We were working on alternate care sites, working with the state on regional planning for that, and locally here in the county, we're looking at sites to set up an alternate care site and how we would deal with too many patients for the hospitals. Thankfully, again, I think we've averted that, and so we're redirecting a lot of that resource to really working with our hospitals actually who have more staffing, and we've had staffing concerns and issues in our long-term care facilities and nursing homes, so really redirecting that. We've got a whole task force aligned now and working, again, with various community, local, and some of our state resources to help augment that. So that's just a little bit of all the response that we're doing that I wouldn't say are totally unique to our county, but we're, of course, addressing our unique county needs as far as looking at where are the testing deserts. Our other focus now is looking at, we see certainly, and this is a theme in other parts of the country as well, but a lot of our cases are Latino, Latinx, so we really need to make sure we're focusing some testing in those areas. So these community testing sites are really trying to target in places where we're seeing not enough testing. And then the case rate, I think we are similar to what we're seeing, again, in other, certainly in the region. We have lower rates than most of the rest of the country for sure. As far as where we started and where we are now, I think, again, this disease is really hard to completely suppress. So as we continue to identify more cases and make sure they're isolated and quarantined, we will continue to suppress, but especially with this challenge that the knowledge has evolved over time about people potentially being infectious before they have symptoms or without symptoms, it makes it a very challenging disease to completely, we're not going to eradicate it without a vaccine, I don't think, and I think our goal will be to really suppress it to the point where we can, again, try to operate as a community and minimize the spread and minimize harm, and especially to those who are most vulnerable to serious illness.
I'm going to slip in a quick question, and I know we have to let Dr. Pond go shortly, but one of the things that comes up from time to time, or questions that I get, is what will it look like for the schools to reopen again? And, now we're coming to the end of the school year, but looking to the fall, or the governor has even talked about maybe some summer school. What kinds of factors will you be considering, Dr. Pond?
Sure, and I actually have a call with the schools almost every week, and then we have a regional call with the county superintendents and the health officers about every couple weeks. We are about to update our camp guidance, which is an initial step towards that, of thinking through camps. Right now for camps specifically, we're trying to try to keep them in groups of 12 in a stable group, which is ideally for about 4 weeks at a time, rather than switching every week the way sometimes at least my kids always did, and I know many other kids. So we are going to try to slowly expand the idea. Right now, we want you all in your household bubbles, right? Your social bubble is really just your household unit. So what does that look like to slowly expand the number of contacts you have, but still limiting that to limit disease spread? So some of the concepts around school opening will be, can you keep the classrooms to a limited, bubble size and minimize mixing between classrooms? Can you physically distance in those older kid settings? And, of course, we all know with younger kids that's almost impossible. So then we just work on that sort of bubble concept. So we're having a lot of conversations. There's evolving guidance. You may have heard sort of the controversy as well about the CDC had some guidance that we're all looking at. It wasn't released more formally, but many of us have seen now the CDC guidance around that too. So we're having active discussions. I think it's going to be a combination and balance, again, of how do you minimize the number of contacts each individual kid and or staff has, and how do you physically distance for the older kids that can physically distance, and still try to have some education. There may be there's a lot of talk too about staggered, maybe some kids are coming in 3 days a week, 1 week, and 2 days a week the next, so that half the kids be coming, because we all know, again, learning is just really hard virtually, and especially, again, if homes don't have Wi-Fi or don't have computers at home. So trying to do a lot of creativity. And I think in general, not only schools, but for each of the sectors, that's where we're really relying on people who actually do that work to think about these key principles, physical distancing, minimizing the social contacts, and how do you operationalize that, given the context of whatever it is, whether it's a restaurant or a school or another business. So that's what I think that's what we really want everyone to be thinking about now, because we do want and need to get to that place and still try to minimize exposures.
Thank you so much. It's now, Sarah, you may have more questions for the doctor, but I want to do a time check with you, Dr. Pond. We'd said 45 minutes, and we've exceeded that a bit. Do we need to thank you and let you probably have your lunch?
Yeah. Yeah, I think I do need to get moving to the next thing. Yeah.
Well, I want to thank you again so much, myself personally, for you taking the time out of a very busy schedule, and thank you for my residents and other guests who are listening. And as I say every week on the call, we just can't thank you and all the other folks at County Public Health for all you're doing to to educate us and help us keep ourselves and others safe. So thank you for the wonderful job you're doing. And a little bit early, happy Mother's Day.
Oh, thank you. Thank you. All right. Thank you to everyone else, and stay safe out there. Make sure you wash your hands, cover your face, and stay physically distant.
I
Okay.
tell them
Thank
that
you.
all the time. And thank you. We'll say goodbye to Dr. Pond. I can stay on, though, and answer any questions that I'm able to send. Thank you so much, Dr. Pond.
Bye.
Bye-bye.
Lots more questions about Tesla, but I don't think that's I don't think that's for the mayor.
Well, if I was talking to Elon Musk, I would give him a bit of advice. Get me his phone number, Sarah. Okay. Anyway.
Somebody's asking what are the penalties for violating shelter-in-place orders, and who has the enforcement responsibility?
Excuse me. Eventually, it could lead to a fine. I know that our police officer has said that our police chief, Paul Roleri, has said they start with education before enforcement. But given that we're now in our 7th or 8th week of this shelter in place, I think people should have gotten the memo by now. And so the way some of the way enforcement works is on the county public health website. There is an email and I think also a phone number that you can use if you believe that a business is operating in violation of the shelter-in-place order. The county sheriff oversees that, and he directs these reports to whatever the jurisdiction is, whether it's a city police chief, or if it's an incorporated area of the city, to the sheriff's department, and then they will send officers out to investigate. And if a violation is found, yeah, it could be as much as a monetary fine, and there might even be some jail time. Would have to read the code sections more carefully to say that, but don't be a scofflaw. And again, as I've said more than once, you can't cheat a virus. I mean, at the end of the day, it's your health, your community's health, a loved one, or someone you don't even know. But I do think, and given the relatively low rate of infection that we're seeing in our county, you are doing a good job. It's tough, it's not easy, but keep doing what you're doing. It is working.
I had a few questions about Alameda Hospital. This one is asking about the safety rating, which they say is rated an F, and they're asking what's being done to improve the hospital.
I have not seen that rating, and so I'm not going to answer a question out of context. I do know that, because I've been in contact with our county supervisor, Wilma Chan's office, that the County Board of Supervisors has sent a team in, maybe more than once, and unannounced, to Alameda Hospital to check on some reports that staff did not have appropriate levels of PPEs, personal protective equipment, and that is they were satisfied with the results. But so it is the Alameda Hospital is the name. It now is under the auspices and direction of the Alameda Health Systems, which is related to Alameda County, and it includes Highland Hospital, Alameda Hospital, San Leandro Hospital, the other hospital out in San Leandro, which I'm drawing a blank on the name. But anyway, that is the entity that would oversee safety factors. I'm the mayor of the city of Alameda, and I did lead the campaign a number of years ago to keep Alameda Hospital open, but it's never been a part of the city. It is located in the city, and we're fortunate to have a hospital in our city. But that's as much as I can tell you that I know.
I'm just going through these questions. Most of them are very specific to health or Tesla.
I gotta catch up on my news about, can't he just make ventilators?
Let's see. And then a bunch of thank yous. Oh, here's the email for Elon Musk, Mayor. I'll give it to you after the call.
Right. Oh yeah, okay.
From one of our CNBC reporters.
Oh, thank you.
Here's a question from Mayor Ashcraft. Why didn't the city manager enforce violations of non-essential workers during the month of April? Why did he in the building department disassemble and even enable non-essential construction at homes and in developments at the point?
Oh, you know what? The construction that was going on at Alameda Point was housing that included affordable housing, and that was considered an essential activity from the very beginning. Because one of the things the governor knows, our county public health officers know, is that this housing crisis is not taking a break because of the COVID-19 pandemic. If anything, the housing crisis has really been brought more starkly to the forefront. That the governor has directed us to get people out of these encampments that have the potential for becoming a cluster of COVID-19, that you cannot keep people safe and healthy while they're living in these situations without sanitation. And in Alameda, as you know, we were able to get some FEMA trailers at no cost from my friend and neighbor mayor, Libby Schaff, next door in Oakland, who had more than her city needed. And then at city cost, certainly we have hooked them up to utilities and all, but that enabled us to get some folks out of the encampments in Alameda who were not COVID positive, but were considered medically fragile and in danger of and vulnerable to getting COVID-19. So we've gotten people there, but at the same time, that construction going on at the point, I mean, the building that you see that looks ready to move into is ready to move into. That is senior affordable apartments. Those are apartments for low-income seniors, including formerly homeless veterans and their families. About 50% of the 62 units will be set aside for those veterans and their families, and others for low-income seniors. We've got a multifamily apartments going up along the Ralph Appiato, or Main Street as you're driving down toward into the point. So no, those were never considered non-essential activities. We got to get people housed. We have a housing crisis in the Bay Area because we don't have enough housing, and Alameda is doing our part to address that. Are we wrapping up on questions, Sarah? Or
Yeah, I think this is coming from the same person, and they were also asking about the construction deliveries for non-essential construction, for example, large shipments of landscaping materials.
Well, as you know, landscaping is now a business that is allowed to reopen because it's done outdoors. You can generally do the social distancing. So I guess it would follow that landscaping materials would go along with landscaping work. And remember, everyone, we want to get the economy up and moving again. And so what Dr. Pond had said in the last conference call that I was on with other electeds in the county was that there is still what are called essential services, certainly your medical work and first responders and grocery store clerks and food bank workers and all those good things. But now we're moving to low risk versus high risk businesses to see which ones can be opened safely with minimal risk of spreading COVID-19. And so this is something to celebrate. I mean, we have had this little hiatus where there were no, hardly any traffic on the roads and all that, but that's not a reality. It can't be sustained. If you saw the unemployment numbers today, 20 million across the country, numbers we have not seen since the Great Depression, that is something that we need to move as quickly and safely out of as we can. So the businesses that are allowed to open will open, and the county has put forth very detailed regulations of how you do construction and these different activities. Sarah, I think we can take maybe one or two more questions.
Okay, sure. Here's one. What is the status of the South Shore building of the tall apartments, the South Shore Development Project?
So, that was probably more in the mind, the concept of a developer than it ever was in reality on paper. It's not to say something won't happen there, but even when they put out some, photographs, or not photographs, but drawings and sketches and things in the newspapers, they'd never been to the planning board. They'd never submitted plans to the city. They still haven't. And so I don't know because I don't have direct personal information, but I could speculate that, like many projects right now, people involved in them and in financing them are just taking it kind of slow and cautiously to see what their finances are going to look like. Projects that were already under construction, that's the good news. They're getting back up and running. But for ones that were that speculative, that hadn't even gone, met with the planning department to see, what sorts of parameters there are. That one I would imagine has a long ways off. But that said, our planning and building department are up and running, open for business. You don't come into the building and put your plans down on the counter the way you used to, but they're doing their work virtually. So if you've got a project, get in touch.
We're at 1:00.
All right. Well, then I just want to thank everyone for your time, for being here today. And for my Alameda residents, I really do appreciate and I'm proud of you for being as compliant as you are. You have taken this with good nature. Okay, I get a few complaints, but I get it. It's hard sheltering in place. It's hard having your movements and activities curtailed, but you get it. You're doing it. You are making a difference. So I thank you. I'm grateful for you. I want you all to stay healthy, do everything the doctor told you to do. And we will be back next Friday with another exciting guest or guests. They just keep coming. In the meantime, take care, stay safe, be Alameda strong. Thanks, everybody. Bye-bye. Have a great weekend.